What if the biggest danger of COVID in 2026 isn't how sick it makes you, but how easy it is to ignore? Right now, doctors across the US are warning that millions of people are walking around feeling mostly fine, yet struggling with brain fog, exhaustion, anxiety, poor sleep, and a slow drop in quality of life without realizing what's really happening. Maybe you've felt it too, the constant fatigue that coffee doesn't fix, the stress that feels heavier than usual, the workouts that suddenly feel harder, or that nagging sense that your body just isn't bouncing back like it used to. The scary part? These aren't random issues. They're early signals tied to immunity, mental health, cardiovascular health, and lifestyle balance, and most people are brushing them off as normal stress. That's the trap. Because while the symptoms feel mild, the long-term impact on well-being, emotional health, and disease prevention can be massive if ignored. Here's the good news: this isn't about fear or panic, it's about awareness, self-care, and smarter preventive medicine. By the end of this, you'll understand the new symptoms doctors are seeing, why they're different, who's most at risk, and exactly how simple daily habits, nutrition, movement, stress reduction, mindfulness, and better sleep can protect you and your family in 2026 and beyond. Stay with me, because what you're about to learn could quietly change how you approach your health for the rest of your life. Doctors across the US are realizing that COVID in 2026 doesn't knock on the door the same way anymore, and that's exactly why so many people miss the early signs. Instead of the classic cough and fever combo, patients are showing up with intense brain fog, emotional instability, and a deep, stubborn fatigue that quietly chips away at mental health, well-being, and everyday performance. Physicians describe people who look physically fine but feel mentally wiped out, like their brain never fully boots up, even after a full night of sleep, which slowly erodes quality of life, increases stress, disrupts sleep improvement, and pushes self-care to the bottom of the list, right where disease prevention should never be. On top of that, doctors are seeing more irregular heart rhythms and shortness of breath, even in younger adults who follow a healthy lifestyle, stay active, and keep up with regular exercise. Picture someone who runs 3 times a week, eats a balanced diet, focuses on proper nutrition, yet suddenly feels dizzy just walking up the stairs. Physicians are now connecting this to inflammation that affects immunity, cardiovascular health, and the body's ability to recover under pressure. Digestive changes are also becoming more common, impacting appetite, emotional health, and weight regulation all at once, which interferes with healthy weight loss and long-term balance. Nutrition specialists are responding with practical preventive medicine strategies, anti-inflammatory meals, omega-3 rich foods, magnesium, and natural therapies like herbal teas, breathwork, and mindfulness practices to support stress reduction and better sleep. What's most concerning is how quietly these symptoms begin, often as a vague sense of being off, less focused, less motivated to move, think clearly, or take care of yourself, because when the body whispers instead of screams, most people ignore it. And that sets the stage for understanding why these symptoms are so different from anything we've seen in past variants. What doctors are seeing now makes it clear that COVID in 2026 isn't just another repeat of the past, it's playing a longer, sneakier game inside the body. Earlier variants hit hard and fast, but these newer patterns linger, quietly disrupting immunity, mental health, and emotional balance over time. Instead of a short illness followed by recovery, many people experience low-grade inflammation that messes with stress hormones, sleep cycles, and cardiovascular health. That's why someone can test negative, go back to work, and still feel off weeks later, struggling with focus, mood, and energy even though they should be fine. This slow burn effect chips away at well-being and quality of life, especially when people push through without prioritizing self-care or preventive medicine. The virus now seems to interact more with the nervous system and metabolism, which explains the rise in brain fog, digestive changes, and unexplained fatigue, even among those who eat well and stay physically active. Think about how chronic stress slowly drains a battery instead of flipping a switch. That's how these symptoms work, and ignoring them only deepens the imbalance. Doctors are responding by emphasizing long-term strategies like balanced nutrition, anti-inflammatory foods, consistent exercise instead of extreme workouts, mindfulness, and natural therapies to calm the nervous system and support sleep improvement. Patients who adopt these habits early show better recovery curves over months, not days, reinforcing that prevention of disease now depends more on daily lifestyle choices than quick fixes. And once you understand how this virus behaves differently inside the body, the next question becomes unavoidable: who is actually most at risk right now, and why some people seem to get hit harder than others? Right now, doctors are clear that risk in 2026 isn't just about age or having a long list of medical conditions, it's about how resilient the body and mind really are. People dealing with chronic stress, poor sleep, low physical activity, or unmanaged mental health challenges are showing symptoms more often and recovering more slowly, even if they look healthy on paper. A 35-year-old who works long hours, skips meals, lives on caffeine, and barely moves outside the office may be at higher risk than a 60-year-old who prioritizes balanced nutrition, regular exercise, mindfulness, and emotional health. That's because stress overload weakens immunity, disrupts cardiovascular health, and reduces the body's ability to self-regulate, making disease prevention much harder. Doctors are also watching people who had repeated mild infections, since each one can quietly stack inflammation over time, eroding well-being and quality of life without obvious warning signs. Pregnant women, caregivers, and people juggling financial pressure or multiple jobs are especially vulnerable because self-care often becomes optional instead of essential. Preventive medicine experts now encourage simple, realistic shifts, consistent sleep schedules, 20 to 30 minutes of daily movement, protein-rich meals with vegetables, and stress reduction habits like breathwork or short walks to rebuild balance without overwhelming the system. Patients who commit to these basics see measurable improvements in energy, mood stability, and long-term immunity within months, not years. And once you realize that risk is shaped more by lifestyle patterns than labels, it raises an even bigger concern. When do mild symptoms stop being no big deal and start signaling something serious? One of the biggest mistakes people are making in 2026 is brushing off mild symptoms as stress, aging, or just a bad week, when doctors now know those small signals can be early warnings. Subtle brain fog, slightly elevated heart rate, poor sleep, or unexplained anxiety often show up before bigger problems, quietly affecting mental health, emotional balance, and overall well-being. Physicians are seeing cases where someone ignores light dizziness or fatigue for months, keeps pushing through workouts and long workdays, and suddenly hits a wall with cardiovascular issues or severe exhaustion. This isn't about fear, it's about awareness and disease prevention. When the body is under constant low-grade inflammation, immunity drops, recovery slows, and quality of life shrinks without dramatic symptoms to grab attention. Preventive medicine specialists now advise tracking patterns instead of isolated moments. If sleep quality drops for weeks, if workouts feel harder than usual, if mood swings become frequent, those are signals to slow down and adjust. Practical steps like temporarily reducing workout intensity, prioritizing balanced meals with anti-inflammatory foods, limiting alcohol, and practicing mindfulness or natural therapies can stabilize the system before things escalate. People who respond early often avoid months of setbacks, medical bills, and emotional burnout, proving that self-care isn't selfish, it's strategic. And once you learn to spot these early signals, the next logical question becomes how to protect yourself and your family before symptoms ever show up. Protecting yourself and your family in 2026 isn't about panic or extreme rules. It's about building a strong foundation that supports immunity, mental health, and long-term well-being. Doctors are emphasizing daily habits that actually work, like consistent sleep schedules, stress reduction routines, and realistic physical activity instead of all-or-nothing workouts that burn people out. Families who focus on balanced nutrition, lean proteins, vegetables, healthy fats, and hydration see fewer energy crashes and better emotional health, especially when meals become a shared routine instead of rushed fuel. Preventive medicine now blends movement, mindfulness, and natural therapies, such as breathwork before bed or short walks after dinner, to improve sleep quality and resilience. Simple actions like opening windows for fresh air, staying home when feeling off, and keeping up with regular health check-ins help catch issues early without disrupting daily life. Over time, these habits stack, leading to healthier weight management, stronger cardiovascular health, and a noticeable boost in quality of life for everyone in the household. The families who thrive aren't doing anything fancy, they're consistent, informed, and proactive about self-care. And once these basics are in place, the real shift happens when you realize how small, steady choices today quietly protect you from much bigger problems tomorrow. Remember how overwhelming it felt at the beginning to realize that COVID in 2026 doesn't always show up loud and obvious, but quiet, subtle, and easy to ignore? Now you see the difference. You understand how small symptoms connect to mental health, immunity, cardiovascular health, and long-term quality of life, and why self-care, balanced nutrition, regular physical activity, stress reduction, and better sleep aren't optional anymore, they're your frontline defense. The real question now is simple. What are you going to do with this knowledge? Are you going to keep pushing through fatigue, brain fog, and stress, hoping it just goes away? Or are you ready to choose a healthier lifestyle built on prevention, balance, and emotional health? Every walk you take, every night of proper sleep, every mindful pause, and every nourishing meal strengthens your future self more than you realize. You don't need perfection, just consistency and awareness. So take a moment and ask yourself, what's one habit you can change this week to protect your health and your family's well-being long-term? If this video helped you see your health differently, hit that subscribe button and turn on notifications so you don't miss tips that can truly transform your health forever. You're already breaking the cycle of ignoring the signs, now keep going.